I'm Dr. Trudy Larson. I am an MD, and I have been in academics my entire career. And my research has really focused on infectious diseases. And in particular, I work with HIV/AIDS and have for over 30 years. And I've also worked with immunizations and vaccines because they have everything to do with how we address and prevent infectious diseases. I also have a real interest in making sure that people know about the impacts of their behaviors on their own health. And HIV in particular is one I think is really important to address. HIV started actually in Africa, probably 80, 90 years ago, when a virus very similar to HIV transferred from primates, apes, to humans. And it was through blood exposure when there were killings. Somehow the virus changed, mutated, and was able to take hold in populations. HIV, well, that's actually what its problem is. It mutates very rapidly. And so it's been very difficult for us in public health and in medicine to really try to figure out a way to inoculate, vaccinate, stop HIV because it mutates so fast. So what can we do with HIV? Well, we know how it's spread. It's spread through sex, it's spread through blood sharing, and it can be spread from a mother to a baby, and that's it. It really is very much confined to very intimate exposures, where you really have to have your susceptible mucous membranes, your mouth, your genital area exposed to the virus. And that's when infection happens. So we know how it happens, but behavior changes are really, really tough. And so what we've tried to do is figure out, can we produce a vaccine? Not so far. Can we treat HIV? Actually, does it have to be fatal? We can treat HIV. And in fact, we have such successful treatments now that people who get HIV can live a totally normal life. They live for 40 to 50 years if they're very young when they start. But instead of dying of HIV, they die of the other things that everybody else dies of. But they have to take medication every single day. And that's very important. I think the new updates for HIV is that when people take their medications every single day, it gets rid of the virus in their blood, and they become less infectious. So if you really look at the strategies to stop HIV, HIV-free generation, there's many, many projects out right now. It starts with, one, people getting tested. If you don't know you have HIV, you can't be treated. So we want everybody to know their status. Test for HIV. You can't tell by looking. You have to have a blood test. Number two, if you're infected, get into care, get treated. If you get treated, your health will be significantly improved and you stop transmitting to others. That's a real significant way that we can really halt HIV. HIV, well, obviously is a virus, the human immunodeficiency virus. It's a virus that causes the immune cells in the body to be destroyed. And so it ruins your immunity, your ability to respond to infections and cancers. So when somebody has had HIV for a very long time, and the average is like 10 years, you actually then finally start to have symptoms. Before that, you don't. And so the symptoms can be quite severe. Weight loss, you can get very unusual infections. You can lose lots and lots of weight, have pain, many characteristics that define AIDS. It's interesting because we don't see that as much as we used to, because testing is becoming more widespread. In fact, the CDC recommends that everybody get tested at least once to understand if they're infected or not. And if they have ongoing risk, unprotected sexual exposures, doing IV drugs, sharing blood, that they be tested every year to make sure they don't get HIV. It's important to, as you look at HIV, now 35 years old, to identify how far we've come for treatment. But we still have the same basics that we need to worry about. You need to be careful with your sex and your sex partners. You need to not share blood products, and if you're a mom, you always need to get tested, because when you're treated, you can stop that disease spread to your baby.